All right, let's get into something really important today. We're going to break down a massive plan that could completely reshape how a country with over 1 billion people gets ready for the next big health threat. We are talking about India's national One Health mission. So, let's dive right in.
This is the one question that's been on all our minds since 2020, right? The last pandemic really showed us that our health systems, not just in one country, but all over the world, were pretty much playing catch-up, always reacting, never really ahead of the curve. But what if? What if we could actually see these crises coming and stop them in their tracks?
And here's why this is so incredibly urgent. Get this, almost 60% of all new infectious diseases that pop up are zoonotic. That means they jump from animals to people. And this isn't just some static number, it's a threat that's growing. As we expand into wild habitats, and as our climate changes, we're basically rolling out the welcome mat for these spillover events. We're talking about things like bird flu, Ebola, Nipah virus. The list just keeps getting longer. The line between animal and human health, it's getting blurrier by the day.
So how in the world do you fight a problem that doesn't respect species boundaries? Well, you need a totally new way of thinking about it. And that's exactly where this One Health approach comes in. It's a real paradigm shift. So the whole idea here is that One Health isn't just about us, about humans. It's this recognition that our own well-being is completely, totally tied to the health of the animals we share the planet with and the environment that sustains us all. Think of it as one single, interconnected system. If one part is sick, the whole thing is at risk.
And what's really crucial to understand is that this goes way beyond just preventing pandemics. Think about the superbug crisis, antimicrobial resistance. That's a classic One Health problem, right? It's driven by the overuse of antibiotics in both us and in our livestock. Or what about climate change? That's not just about floods and fires. It's about new weather patterns that let disease-carrying insects move into brand new areas. This approach even helps protect the livelihoods of millions of farmers, because a single disease that hits livestock can just wipe out an entire rural economy.
Okay, so recognizing how all these dots connect, India is really stepping up with a big, bold strategy. Let's get into the nuts and bolts of the National One Health Mission, or NOHM for short.
The vision here is crystal clear, and it is ambitious, to build one single, unified system for controlling diseases and getting ready for pandemics. The keywords you got to focus on are integrated and preparedness. This is all about moving away from that old, fragmented, run-around-at-the-last-minute kind of response.
And let me tell you, this isn't just some proposal. It has some serious weight behind it. It's got the green light from the Prime Minister's top science council. The Indian Council of Medical Research, one of the country's most important medical bodies, is the one steering the ship. And it's all going to be anchored at the brand new National Institute of One Health in Nagpur, which will act as the central hub for everything.
Now this slide, this right here is the real game changer. It shows the fundamental shift in thinking. We're moving away from that old reactive model, waiting for the fire to start and then rushing to put it out, to an anticipatory one. The goal is now to predict and maybe even stop those animal-to-human spillovers from ever happening in the first place. And you do that by tearing down the walls that have always separated human, animal, and environmental health.
Okay, so that all sounds great in theory, but how does this mission actually work on the ground? Well, it's built on 4 key pillars that really form its backbone. Let's break them down.
First up, a huge push in research and development for new vaccines and diagnostic tools. Second, making sure our hospitals and clinics are always ready for anything. Third, and this one is so important, bringing all the data from human, animal, and environmental monitoring into one single system so we can actually connect the dots. And finally, getting communities involved directly because they're always the first line of defense.
Now the good news is this mission isn't being built out of thin air. India has actually already laid some pretty important groundwork. Let's take a look at how this new mission is going to build on that solid foundation.
So there's already a Center for One Health, a special unit in the Department of Animal Husbandry, and a whole national network of high-security labs that can analyze diseases quickly. What this new mission will do is bring all these pieces together, unify them, and scale them up in a big way, all while making sure they're in sync with the global One Health plan from groups like the WHO.
So, the vision is powerful, and the foundation is definitely there. But what's next? What does the road ahead look like? And what are the absolutely critical steps needed to make sure this mission is a real, lasting success? All right, so the roadmap involves some pretty heavy lifting. We're talking about creating a formal authority that can actually break down those old bureaucratic silos. It means launching huge training programs for people on the ground and building a single national digital platform. Just imagine a veterinarian in one state sharing data that instantly alerts a public health official in another. And critically, it also means weaving in climate change strategies, using models to predict where the next disease hotspot might emerge because of changing weather, and getting there first. It's about making public health truly predictive for the first time.
And this quote, well, it just sums the whole thing up perfectly. This mission is all about creating a health system that's not just integrated, but anticipatory. It's about governing health by looking at the whole picture, people, animals, and the environment as one single, unified entity.
You know, it is a monumental task. The ambition here is absolutely massive, but then again, so are the stakes. If it succeeds, this mission could literally write the playbook for the rest of the world on how to get truly prepared for whatever health challenge is coming next. So what do you think?